I deal with a lot of youth overhead athletes, in particular baseball players, and really baseball players of all levels. So we've done a lot of biomechanical analyses in the past and looked at hundreds and hundreds of these players. And there are some resounding themes, but we've also done musculoskeletal screens and assessments on them. And there are, again, resounding themes with a lot of these athletes. So when I'm thinking about the kinetic chain and the overhead throw, and again, I'm a physical therapist, so I'm coming from the standpoint that this is a injury prevention or musculoskeletal assessment versus a performance assessment. Um, I mean, keep in mind that if you correct some of these musculoskeletal impairments, that your performance is most likely going to improve. But these are some of the things that I've seen. So, if you think about the throwing motion, right? Balance on the backside, land on the front side. I've had some YouTube videos talking about this already, but you need control on the front side. You need to have adequate hip and shoulder separation, thoracic spine motion, shoulder external and internal range of motion with strength, core control, and then, of course, posterior shoulder strength for deceleration. So you've got to connect that entire chain, and every part of the body is working together to generate as much velocity as possible. And I mean, obviously, that's the name of the game now: is how much velocity can we generate? And the kinetic chain, I mean, is really, really imperative to throwing hard. You can see some pitchers. I mean, if you watch MLB, there are some pitchers that are literally 180 pounds and they throw over 100 miles an hour. And the only way that you can do that successfully is to maximize the potential power from your kinetic chain. Then you have other pitchers that are over 250 pounds and throw very hard also, and some of them just have pure strength. So maximizing the kinetic chain is essential. If you look at enough of these young players that come in, I think that it's eye-opening when you hear their stories and you hear how they're working on all these velocity programs, but you ask them to stand on one leg and they can't do it. Right? If you can't stand, if you're a right-handed pitcher, but you can't stand in balance on your right leg for a couple seconds, how are you ever going to start in an efficient place and be able to transfer that power down a mound? So before you put the velocity programs into effect, before you pick up a 32-ounce weighted ball, why don't you just try and balance on one leg first? So that's one of the biggest things I see in these youth players. So balance is always number one, right? So can you balance? From there, can you do a simple lunge? Can you control a lunge position? Because you're going to go, if you're a right-handed pitcher again, you're going to lunge onto that front foot. So as you land on that left foot, can you absorb the force? But more importantly, can you come out of that? Can you extend that front knee? Yes or no? I will have all of our youth players that come in, and even high school and collegiate guys, I will have them try and do 5 dead bugs. And it is amazing how many of them cannot do a dead bug, and how many of them do not have good core control. So even if you have strong legs and strong arms, but your core is weak, there's no way you're going to efficiently transfer all of that power from your legs to your arm. So for me, very important that there's good, very good core control. After the core comes to the shoulder blade, right? So the power is transferred from core to the scapula, to the shoulder, to the elbow, to the hand. So the scapula is next. And if you watch some of these guys move, a lot of scapular winging, which we can debate scapular winging, but if you have them do a posterior shoulder endurance test, or watch them move just from flexion into the position of flexion or external internal rotation, the scapula tends not to move properly. There are some neuromuscular control issues. For the posterior shoulder endurance test, usually we'll have them prone on a table, thumb rotated out to the side. So doing a prone T with 2% of their body weight, and the goal is 25 repetitions. That tells me if they have adequate endurance in the back of their shoulder. But I'll also watch them just elevate their arm from behind and looking to see that shoulder blade and the scapula upwardly rotate and protract as they come up. So again, starting at the leg, balance, yes or no. Can they get into and out of a lunge? Can they do a dead bug and control their core? Do they have adequate shoulder blade and shoulder strength? Yes or no? From there, then I'll watch them throw. And when I'm watching them throw, usually most of the younger ones, what I've seen is that they have a hard time landing and controlling on their front side. So right-handed pitcher, again, lands on that front leg. If you watch the best pitchers in the league do this, their ankle, their knee, and their hip are lined up on that front side. When a lot of our younger guys do it, or even some high school collegiate guys that have poor control of that front leg, you'll see their knee collapse in. So the knee will come inside their angle of their foot and their hip, and then they'll pull it back out. And then on top of that, they tend not to be able to block their front side and extend off that front leg. So when I see someone throw and I'm watching their front leg and they land, their knee is flexed, and it either continues to bend or doesn't straighten out on that front leg, then that is telling me that they're not maximizing the power that they've developed from the ground and transferring it to the next body part, which is the hips and the core. Right? So if you're not extending and blocking that front side, you're not getting all your power to the core, so you're losing some power and you're losing some efficiency. And then you get to the core, and do they have adequate hip and shoulder separation? And very basic, you don't need a multi-million-dollar system to tell you this. We will use it on some of our professional players, but very simply, when that front foot lands, your chest should still be closed. Right? So as a right-handed pitcher, when that front foot lands, your chest is still pointing towards third base as the hips are opening. So what you're thinking about is your pelvis is rotated, but your shoulders have not rotated yet. So you're creating some torque and some twist between the hips and the shoulders in the core. So you're winding up that rubber band. So are you doing that? Do you have the range of motion to do it? And do you have the strength to do that? On top of that, and that's where you get your core control and your core mobility from, right? And then you're going to come into a position of max shoulder external rotation. And I don't find that many people have trouble getting into external rotation or internally rotating as they're throwing the ball. But the next thing I do see sometimes is that they're not able to fully, or they don't go into a full follow-through position. And what I mean by that is when they release the ball, that the arm sort of stays there and the chest doesn't flex forward, the arm doesn't come across the body. So they're not decelerating the arm properly with the muscles in the back of the shoulder. So we also know that the arm is accelerating at a rapid pace. When you release the ball, there's enough force, the distraction force, which means the force that's pulling the arm off the body, is equivalent to at least your body weight. So for a younger pitcher that's 150 pounds, they have 150 pounds of force trying to pull the arm out of the socket when they release the ball. So if your muscles in the back of your shoulder and your hips and your back and that whole posterior chain are not strong enough to withstand that force, you're going to destroy your shoulder joint. You're going to get labral issues, bicep issues, posterior rotator cuff issues, posterior capsule issues, posterior impingement, rotator cuff, scapular issues. We've seen scapular stress fractures. So these are all things that can be avoided if you move properly and you have adequate control and strength. So a long answer to a short question about what I typically see is I typically see that our younger players tend to move towards more of the velocity programs before they're able to control their own bodies. And it's very important you're able to control every segment of the body and move efficiently and have adequate strength and range of motion. And that's what's going to allow you to, one, stay healthy, two, what everyone's looking for, throw harder. But just really important that everybody understands that. And again, you don't need these high level assessments on everybody. I think a movement assessment, a general movement assessment, range of motion, strength assessment, and then some aspect of video biomechanics can be very helpful in, one, preventing injury or minimizing risk of injury, and then two, improving performance. Because we know that if you move better and if you sequence properly, you will definitely be able to throw with more power. Will the ball go where you want to go? Well, I mean, you've got to work with a pitching coach, and hopefully you've got a little DNA on your side. But that will all get you stepping in the right direction so that you can start to throw more efficiently, again, with less stress on all the structures around your arm and your body, and hopefully stay healthy for a long time.